All right, so this was today. I took some professional photographs, so I take basically two different types of sequences of photographs. Like I did in my previous video. I think I did one just for basic diagnostic records, or maybe it was for Invisalign, but here I'm doing what I call, I nicknamed it Glamour Shots. And they're basically just a sequence of shots that right now it's a certain sequence that I use every single time for beginning and final photos for somebody doing veneers. This person happens to be a Smile giveaway winner, and we kind of talked a little bit. Usually these photos go a little bit quicker. I can get them all done in about 5 minutes, and you can see here that my camera movements don't really move a whole lot. I'm standing straight in the same spot. My feet are in the same position every single time I'm taking a photo. And the only time when I'm moving to the side, I'm reaching, and typically I don't move my left foot. It's always staying in the same spot, so that way I can get consistent photos every time. Now, I went through the sequence really quick. I just took a straight on shot, had her turn her head to the left 45 degrees, to the right 45 degrees, and I specifically said turn your head 45 degrees to the left. For some reason, people know how to do that. Sorry to interrupt the video, Doc, but there's something that we need to take care of, and that is make sure that you have a photo release form for your patients so that you don't violate HIPAA law. If you're taking dental photography and you're exposing their face on social media such as Facebook, Instagram, TikTok, whatever, you need to have this form. So if you do not already have one, there's a download link that you can download a free template where you can customize it for your practice. So let's go ahead and get back to the video. And they know what that angle is. I just gave her here some retractors. These are the cage retractors that I highly recommend that you purchase. They're on Amazon. I think they're like 15, 16 bucks. And what I tell the patient when I'm taking photos is the only thing that I have to say is, I'm gonna need you to fish hook yourself. And that key word, fish hook, they automatically know what I'm talking about. So I'm having her do that. And I'm actually doing the contrast shot right here. And I think I do the regular just cheek retractor set after this. But what I'm having her do is hold the cheek retractors at 45 degrees on up. Okay, and then I'm basically resting the contrasting plate on her bottom jaw, and I'm just having her basically hold her head there, and I take the shot and I'm done, and that's it. This is Kylie. She kind of helps me sometimes take these photos. This is actually a friend that's got the Smile giveaway. So I think I take a total of 8 shots. I do the extraorals first, and then do the intraorals, and then I do the contrast shot. And the last shot that I do is that portrait shot. And all these shots are done at 75 millimeter. Now you notice this room is probably about a 13 by 10 room, and I don't have a whole lot of space. So if I used a 100 millimeter length lens, it'd be very tight, and I wouldn't get the whole face and the whole shoulders in the frame. So that's all I have for this critique. I'll see you in the next video.